Well, hello, everybody. Welcome to today's discussion on the importance of treating your hearing loss. For the next hour or so, I will walk you through the importance of treating your loss, as well as what you might expect during the process. And who am I, you may ask? Well, my name is Jillian Ryan. I am a registered audiologist who has been in practice for over 20 years. I completed a master's degree in audiology from Dalhousie University in Nova Scotia in 2003, and I am currently enrolled at A.T. Still University in the US, completing my Doctor of Audiology, or AUD. I am the principal audiologist and owner of New Life Hearing here in Newfoundland and Labrador, and have many clinical experience over the years in my field. I love what I do, even after 20 years, and I can't believe it's been 20 years. I have such a passion for hearing health, and I look forward to guiding you through today's presentation. And I thank you today for attending, and for the Canadian Heart of Hearing for offering such a great platform and taking the steps to learn more about your hearing health. So let's begin. So hearing loss is on the rise. You're not alone. We should all be educated on what it means to successfully age. Healthy aging is a very hot topic in today's research because the simple fact is that we are living longer. Life expectancy has increased, and we should all want to learn about how we can take steps towards more healthy aging. We are living longer, we are living with chronic health conditions, but what you may not realize is that an untreated hearing loss is actually correlated with other chronic health conditions. So currently, the statistics show that over 1.5 million people are living with hearing loss, and that is expected to rise to 2.5 million by 2050. That is about 300 million people currently living in the world with presbycusis or age-related hearing loss, and that is expected to triple by 2050. Nearly 25% of those aged 65 to 74 and 50% of those who are 75 years of older have a hearing loss. And age is the strongest predictor of hearing loss amongst adults aged 20 to 69, with the greatest amount of hearing loss in the category to 60 to 69. So the prevalence of hearing loss, to put it in perspective, is twice as common as diabetes or cancer. So you might ask, why should I be concerned about my hearing loss? I hear what I want to hear. I can get by is often what I hear from patients. But recent research suggests that 3 in 4 individuals over the age of 65 actually have multiple chronic conditions. And the rising costs of this on healthcare and the aging population right now are on a collision course. Prevention and earliest possible intervention should be at the forefront of healthy aging, because we are living longer and because we are living longer with chronic health conditions. So did you know that studies show individuals living with an untreated hearing loss have higher rates of depression, anxiety, and social isolation? You're twice as likely to have hearing loss if you're a diabetic, 3 times as likely to experience a fall if you have an untreated hearing loss, and are at a higher risk of cognitive decline or dementia. So the impacts of hearing loss are far-reaching beyond that of communication. It's social isolation, withdrawal, loneliness, reduced opportunity to interact with others, reduced quality of life, increased listening effort, fatigue. All of these items are contributing to our quality of life and our ability to age in a healthy way. So some key facts to consider. I love this graph because it kind of connects our hearing to other health conditions. And it's a great illustration to show that it's not just about our ears and it's not just about communication, but it's our overall hearing health and our overall health that are correlated together. Age-related hearing loss contributes to the acceleration of cognitive and physical decline in adults. It has been shown that even with a mild hearing loss, you are twice as likely to develop dementia And its risk progresses with age, illustrating that even with a severe hearing loss, you're 5 times as likely to suffer dementia. Depression, anxiety, and social isolation are, of course, another risk. Who amongst those listening today has a family member who they feel has withdrawn from their social networks or activities, such as a card group or, book clubs, family gatherings, because it was too much effort to hear and take part? Research has concluded that individuals with hearing loss are more vulnerable to depression, anxiety, and social isolation, and than the general population of those around us. Being a diabetic as well, you are twice as likely to suffer with hearing loss as compared to those without the disease. And one of the shocking ones for me is the risk of falls. We talk about healthy aging and wanting to stay in our homes a little bit longer as we age. And the risk of falls should be at the forefront of that discussion. There is a robust association between falls and hearing loss. You're actually 3 times as likely to suffer a fall with an untreated hearing loss. As we age, falls are more difficult to recover from. So let's consider for a minute what we just spoke about regarding diabetes. So considering diabetes and its association with neuropathy, and we consider the risk of falls, what does that mean? So if you're a diabetic and you have neuropathy and you have unstable footing due to that, you're even putting yourself at a greater risk of that fall. Early audiological intervention may allow prevention of these unnecessary falls. So overall, with a goal of healthy aging, quicker identification, proper treatment of hearing loss in the aging population may actually result in a higher percentage of seniors being able to remain in their own homes longer, lowering the risk of these associated comorbidities, thereby lowering the needs for more institutionalized care. Early detection and prevention are critical to reducing these risks associated with an untreated hearing loss. So, what are the signs? So now we know that we have to treat our hearing loss. How do we know we have hearing loss? And what are the steps that we need to take going forward? Hearing loss often goes unnoticed. And in my patient's defense, I say all the time, with an age-related hearing loss, because it is lost so gradually, you often acclimatize to that loss. It just becomes normal hearing to you. And oftentimes it's family members or those that are closest to you, which are better judges of your hearing abilities. So let's review some of the symptoms so you can see if you identify in these risks in these signs of hearing loss. So do you find yourself misunderstanding people? Do you find that you're turning the television or radio up? Do you have difficulties on the telephone? Do people report that you speak more loudly? Are you having trouble in group settings, background noise, challenging listening environments? You find it hard to hear high-pitched sounds like birds chirping outside, and you're often asking people to repeat themselves. So at this point, I'd like for you to reflect on your communication abilities and, have that intimate conversation with yourself to see, am I really struggling with these signs of hearing loss? So now that we can recognize why is it important to consider our hearing loss and our hearing health, and we recognize these symptoms in ourselves, what are the next steps? So there are many different professionals that can help with hearing loss. So who are they? Number 1 is an audiologist. Number 2, a hearing instrument specialist, a family practitioner or family physician, GP, or nurse practitioner. And mainly the nurse practitioner or family physician is for referral purposes only. Oftentimes patients like to meet with their family doctors, the managers of our hearing health, to kind of, speak to them about what options to take and what they should do. They often refer then to an audiologist or a hearing instrument specialist, or lastly, an ENT, which is an ears, nose, and throat physician. You don't need to have a referral from a family doctor to seek out the services of an audiologist or a hearing instrument specialist, but you do for an ears, nose, and throat professional. So what exactly is an audiologist? An audiologist has a minimal education requirement of a master's degree in Canada. And it's varied depending on who our listeners are today, where you're calling in or viewing from. For an audiologist, it's an intensive university education with clinical practice that prepares us as professionals to exercise their expertise when assessing and managing patients with audiological disorders. So we are uniquely qualified to assess, identify, diagnose, and manage hearing loss and balance disorders with people of all ages. We manage peripheral and central hearing loss, as well as hyperacusis and tinnitus or sounds in the ears. We are trained to perform extensive hearing assessments based upon the outcome of that evaluation. We can provide individualized treatment plans to aid in that communication disorder. Audiologists are trained also to understand and program hearing aids, cochlear implants, assistive listening devices, bone-anchored hearing aids, and more. So like I said, our education at minimal to practice in Canada is a master's level. Some have a doctoral degree, such as an AUD or a PhD. And we're required to complete these rigorous clinical placements or internships as part of our training, and we must pass a national exam in order to practice. In the province of Newfoundland and Labrador, you must be registered to practice in the province, and we require continuing education in order to practice each year. So our education is extensive in that it usually averages 5 to 7 years, depending upon the degree of education, before we can acquire this knowledge to practice. So what is a hearing instrument specialist? So, oftentimes there's confusion around these two professionals. Where we differ is in our scopes of practice, our identification of our education, training, and by our regulatory distinctions. So according to the International Hearing Society, a hearing instrument specialist is a licensed hearing health professional trained to evaluate common types of hearing loss in adults and fit hearing aids. They're typically licensed to perform tasks related to hearing aid fittings, such as programming hearing aids, make ear mold impressions as part of that fitting. Hearing instrument specialists do not diagnose hearing loss or hearing disorders and are not trained to diagnose and treat tinnitus, hyperacusis, auditory processing disorders, and other auditory cognitive processing skills. There's currently no standard minimum education requirement in Canada. It's very based upon the province, and if you're attending based on different provinces or countries, you should certainly check with your area to see what the standard is. Training required to be a hearing instrument specialist ranges anywhere from 6 to 9 months upwards to 2 to 3 years in a post-secondary college training. It's either outlined or completed online or in a college setting, and they also must require a licensing exam in order to practice. They are licensed in the province of Newfoundland and Labrador and can dispense hearing aids. They also require 10 hours of continuing education to practice each year. And what, lastly, is an ENT? So according to the American Academy of Otolaryngology, an ENT is a physician with an expertise in conditions, you guessed it, in ears, nose, and throat. However, their specialty extends beyond parts to the head and neck, sinuses, thyroid, allergies, sleep apnea. They earn a medical degree, and it's followed by a 5-year residency program. There are ENTs, and we are fortunate to have an ENT in our province of Newfoundland and Labrador that is specialized in just ears, and they are called audiologists. These specialists complete an additional 2-year fellowship to train and treat the complex ear conditions and more complex ear surgeries. So, for example, an otolaryngologist that is trained as an otologist performs the surgical placement of the internal components of a cochlear implant. In Canada, ENTs do not dispense or prescribe hearing aids, although they may recommend them as part of the treatment of your hearing loss. So when should we see an audiologist? So anyone with concerns about their hearing health should see an audiologist for a consultation. There are sometimes special circumstances when you should always see an audiologist. So anyone younger than the age of 18 with hearing concerns, anyone with an asymmetrical hearing loss, so a difference between the ears, a sudden onset of hearing loss in one or both ears, ringing, roaring, or tinnitus sounds in one or both ears, a history of exposure to ototoxic medications. So for example, if you're undergoing strong antibiotic treatment for an infection, certain antibiotics are ototoxic to the inner ear. History of chemotherapy and radiation in the head and neck region can also have a delayed onset of some hearing loss. And when should you see an ENT versus an audiologist or a hearing instrument specialist? So sometimes your hearing health concerns extend beyond the scope of an audiologist or an HIS. A referral to an ENT may be necessary. An audiologist or your family doctor can certainly make that referral for you. When you should see an ENT is if you have a sudden onset of hearing loss or fluctuating hearing loss in one or both ears. It's important to make note that if you experience a sudden sensorineural hearing loss with experiences of nausea, vertigo, feeling unwell, that come on quite suddenly, it's most effective to seek the treatment of an ENT within 48 hours of the onset of symptoms. If you have pulsing tinnitus, so in line with your heart, that's you hear in your ears. If you have active fluid in one or both of your ears within the last 90 days, any pain or discomfort in your ears, a feeling of fullness or feeling clogged or plugged in your ears, any congenital or traumatic deformity of the ear or any surgically altered ears, and of course, any dizziness. So when should I have my hearing tested? This is a great question, and we're going to cover this a little bit over the coming slides to see when is the right time for you in completing that test and what to expect from a hearing test. You know, according to the National Council on Aging, hearing aids are associated with substantial improvements in social, emotional, psychological, and physical well-being of people with hearing loss in all categories from mild to severe. Most of my patients wish I didn't wait as long as I did. It's amazing to me that it's commonplace to recommend routine dental cleanings and vision checks, but yet routine hearing evaluations are kind of lost in translation. But now that we know the risks that are associated with an untreated hearing loss, I think that's starting to change a little bit. Anyone with concerns of hearing or communication should see a professional regarding their hearing health. It's never too early for baseline assessment. Hearing loss is not just an age-related condition. Hearing loss is cradle to grave. I used to work at the Janeway, the Children's Hospital here in Newfoundland and Labrador, and seeing wee little souls up to aging individuals with hearing loss all the way across my career. So as discussed, age-related hearing loss has implications that are well beyond that of communication. You know, studies indicate a broader functional indication of age-related hearing loss with risks of cognitive function, depression, social isolation, and even cortical changes in the brain and our overall health. So given these findings, our kind of standard of recommendations of when hearing loss should happen has kind of been changed. All individuals, if you have concerns about your hearing, should have your hearing checked. If you are an individual who is over the age of 50 and have not had a baseline hearing assessment completed, you should have that completed. And patients with a history of depression, cardiovascular disease, diabetes, dementia should have their hearing tested annually. So our recommendations of after baseline, if you have normal hearing, every 2 to 5 years, you should really have your hearing checked. If you have a confirmed hearing loss, you should have your hearing checked either 1 to 2 years or have associated comorbidities such as those discussed. Early detection and prevention are critical to reducing risks associated with an untreated hearing loss. So what can we expect during a hearing assessment? A hearing assessment can be, for some, a daunting experience, but it doesn't have to be. This is a great little video. This is by an audiologist based in the US. His name is Dr. Cliff. He does a great description, and I thought I would insert this video to give us an idea of what it's like to have a thorough hearing examination and what to expect. I just hope the technology works.
Ever wonder what to expect when receiving a hearing test? Well, in this video, I'm going to cover the 5 evaluations that a hearing care professional will use to test your hearing. Coming up. Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Anthem, Arizona. And on this channel, I cover a bunch of hearing-related information to help make you a better informed consumer. So if you're into that, consider hitting the subscribe button. Chances are the last time you had your hearing tested was back in grade school. And that wasn't even a full hearing test, it was just a routine hearing screening. Which is crazy because for years, individuals have been recommended to get routine dental cleanings and vision checks, but not routine hearing evaluations. But with the rising concerns of how hearing loss impacts not only communication ability, but cognitive function, hearing tests are actually being recommended more often. It's actually recommended to have your hearing tested as an adult every 5 years. But if you've had a confirmed hearing loss, you should be getting your hearing tested every year. So what are we actually evaluating when you come in to have your hearing test? Well, basically, we're looking at the 3 different parts of your ear: the outer ear, the middle ear, and the inner ear. The outer ear is made up of your pinna and your ear canal all the way down to your eardrum. The middle ear is made up of your tympanic membrane, otherwise known as your eardrum, the middle ear cavity space, the ossicles, or the 3 bones of hearing, and your eustachian tube. The inner ear is made up of the semicircular canals, which control balance, and the cochlea, which controls hearing function. I also call this your hearing organ. Now that you know what we're testing, I'm going to show you the 5 different things that we will use in order to evaluate the 3 different parts of your ear. The first thing we do is perform otoscopy. This is where we evaluate your outer ear by using an ear light or an otoscope to look inside of your ear canals. We do this to see if there's any obstructions and to visualize the eardrum. It may result in the removal of earwax or some other foreign object, and possibly a referral to an ENT if there's a perforation in the eardrum. Once your ear canal is cleared, you can continue on with the hearing test. The second thing that we will do is air conduction testing. This is where a hearing care professional will put headphones on your ears or inserts in your ears. They will play you beeps for you to click a button or raise your hand, trying to find the very softest sound that you can hear for low pitches, mid pitches, and high pitches. This evaluates all 3 parts of your ear at the same time because sound has to travel from the outer ear through the middle ear to the inner ear for us to be able to determine if you can hear the sound. These are indicated by the X's and O's that you'll see on your hearing test. The third part is bone conduction testing. This is where a hearing care professional will place a bone conduction device on your head that sends vibration directly through your skull into your inner ear. This vibration of the hair cells in your cochlea will cause you to hear the same beeps that you would hear when you wear the headphones or the inserts. But because this vibration bypasses your outer ear and middle ear, it only tests your inner ear. It can provide valuable insight into what is causing your hearing loss and where that hearing loss is located. Bone conduction scores are indicated by the brackets on your hearing test. The fourth part of your comprehensive hearing evaluation is speech recognition testing. This is where a hearing care professional will either say or play recorded words for you to repeat. The words will get softer and softer until we identify the lowest volume that we can play a word and still have you understand what word is being said. The score of this test is used to cross-check with your air conduction testing and is indicated in the speech test score results on your hearing evaluation. The 5th and final part of your hearing test is your word recognition score. This is where a hearing care professional will either say or play more recorded words at a comfortably audible level to see how accurately you can repeat those words. Sometimes we will need to amplify the words if you have a hearing loss. This test evaluates your ability not just to hear, but how well you understand speech. These percentages are recorded under the speech section of your audiogram. If you have a hearing loss, it will provide valuable insight into whether you will receive benefit from hearing aids. There you go. Those are the 5 evaluations that we will use in order to test your hearing. These components will provide a hearing care professional with a foundational understanding of your hearing abilities. It is possible that a hearing care professional will decide to use additional tests on top of these 5 core things in order to get more insight into your hearing abilities as well. This can include things like speech and noise testing, acoustic reflexes, or tympanometry to see how well your eardrums are moving and to see if you have a healthy middle ear space. While a hearing test may seem basic, it's very important that the person testing your hearing has received proper training in order to perform the test and to evaluate the results. When it comes to hearing evaluations, a doctor of audiology is the highest trained hearing care professional in the field. All right, so if you haven't had a hearing test in the last 5 years, and really, who am I kidding? You probably haven't had your hearing tested since grade school. It's about time that you go out and you get that baseline hearing test. After you get that baseline hearing test, do yourself a favor and go in and get a hearing evaluation every 5 years if your hearing is normal, and every year if you have a confirmed hearing loss. That's it for this video. If you have any questions, leave them in the comment section below. If you like the video, go ahead and give it a thumbs up. And if you want to see more videos,
So I love Dr. Cliff. He's very animated and makes it interesting to learn about hearing loss. So let's review. So a hearing loss evaluates the outer ear, the middle ear, a hearing assessment reviews the outer ear, the middle ear, and the inner ear. So those tests allow the hearing healthcare professional to diagnose the type of hearing loss as well as the degree or severity of the hearing loss. This slide outlines the 3 different types of hearing loss that can result from your examination. So you can have a sensorineural hearing loss, which is more the inner ear, which can be caused by aging or noise exposure as an example. You can have a conductive hearing loss that's caused typically by foreign objects in the ear canal, such as wax, or have something indicated in the middle ear space, such as a ruptured eardrum or something going on with the ossicles or the bones in the middle ear. Or you can have a mixed hearing loss, which is a combination of both the sensorineural and the conductive. Your test results should be displayed on an audiogram, as we saw in the video, and also should be discussed with you in depth. So there are various degrees of hearing loss. It's not as simple as a percentage. I know that's a common term that some health professionals like to use to describe hearing loss, but it's not entirely accurate. The audiogram or graph of hearing has pitches across the top or pitches or frequencies across the top, and loudness or decibels that are down the side. The X's and O's are marked in the position where you respond to the softest sound that's being heard during the examination. A typical configuration for early onset hearing loss, for example, tends to be more normal in the lower frequencies. And then we see a gradual slope or decline into a loss in the higher frequencies. It's important, when we think about an age-related hearing loss, because oftentimes it goes unnoticed or it's a deceptive loss because of that configuration of loss. The vowel sounds, which are very boomy and carry a lot of volume or energy on the graph, they're low frequency in nature. So when we have an age-related hearing loss, those low frequencies generally tend to be within the normal range, meaning we hear the vowel sounds okay. However, as we get that gradual slope into the high frequencies, that's where all the consonant sounds are displayed on the graph. And the consonant sounds carry the intelligibility of the English language. So they make our brain understand the words. So if we're losing the intelligibility, oftentimes patients report, I can hear you, but I can't understand you. I know you're speaking, but I just don't know what you're saying. And that's why it's a very deceptive loss, because patients oftentimes will say, well, I'm hearing okay. I hear sounds around me, but they're not able to understand speech and language clear enough to get that intelligibility. So there are varying degrees of losses ranging from mild up to profound. And each one of those degrees of loss comes with a different perception of how you would function while you're trying to hear. With each progressing degree, it's more and more difficult, especially when you're in a group or background noise or a challenging listening environment, to hear and understand speech and the sounds around you. So this is also a great little slide because it more or less pulls together why the ability to hear speech is different based upon different degrees of loss, and illustrating the fact that it's so much more than just a percentage. So for example, with a mild hearing loss, speech may sound muffled, but you can hear it in quiet environments. However, as you get into more noisy or reverberant acoustic environments, such as, a church or an auditorium, it can complicate speech, meaning it's much harder to decipher what is being said. And then as we move down to the moderate severe category, as an example, speech becomes more muddled. Now we're needing to have things turned up a little bit more. Communication within a group is often difficult, and sometimes even in quiet, depending upon the acoustic environment and the speaker, can also be a challenge. So there's lots of misconceptions regarding hearing assessments today, and probably more than there's ever been. The good foundation for good hearing health is always an extensive assessment. Everything that going forward in treating your loss is based upon that hearing assessment. You should expect a series of tests be performed, not just to understand that there is hearing loss, but also to understand potential causes, impacts, and treatments that are necessary for you. So one of the misconceptions that we deal with often in clinical settings is that a screening is not the same as a full assessment. A screening is a brief picture. It takes about 15 minutes. It can be done online, and its purpose is to define the presence or an absence of loss. We're not getting into the degrees of the hearing loss. We're not getting into the functional effects of that hearing loss, versus where a full assessment provides a fuller understanding of your hearing health and approximately takes around 45 minutes to an hour. Oftentimes I hear patients say, well, I don't need a hearing loss until my hearing gets bad enough that I need to have that testing completed. So as we learned so far in our presentation, as well as from the video, having a baseline hearing test is key and should be done at least by the age of 50. So monitoring your hearing health plays a vital role in maintaining a healthy lifestyle. An online hearing test is as good as an in-person test. We're only listening to beeps and tones. We hear this often as well. However, during a full hearing exam, various tests are performed to identify a wide range of ear conditions, such as tinnitus or ear blockages and infections, possible medical conditions that may exist. When you do an online assessment, it's not that same kind of outlook. It's not giving you that expertise in diving into those X's and O's and what it all means to you. You could be completing that hearing testing with a blockage in your ear, even though it's being completed online. No one has looked into your ear canal. No one has looked at the status and checked the status of that middle ear space. So let's review, because there are some best practices that need to be completed during a hearing aid assessment. As we reviewed in the video, a variety of tests should be completed. You should get a visual inspection of the ear canal, middle ear analysis or tympanometry, pure tone testing, bone conduction testing, speech testing, and oftentimes now in today's world, even speech and noise testing. After a completed test, the degree and severity of your loss should be reviewed, and referral to a medical professional, if needed, should be initiated. A review of your results should be discussed with you, with the hearing challenges that you experience, and a comparison to normal should be also reviewed. Only once these steps are taken can recommendations with regards to treatment, for candidacy, for example, for hearing aids be suggested. A needs assessment needs to be carried out. So that recommendation for your needs is thoroughly highlighted with proper device and amplification, can only be chosen if that needs assessment is completed, and that needs assessment is based upon your input in combination with your hearing test results. Without the collection of this information, an outline of your goals, how really is a proper device being chosen for your treatment? Every exam should begin with a discussion of your hearing health background, so a case history, and it should end with an in-depth and in-person review of your results and recommendations for treatment. So that treatment plan or needs assessment should always take place. Complete testing should always include a detailed breakdown of your results with the degree and severity of your loss, with any medical appointments that are necessary should be referred prior to fitting of amplification. If hearing loss is found, recommendations for technology and rehabilitative options or treatment should be reviewed. And again, like we said, a lifestyle needs assessment should be completed. If hearing loss is not found, preventative hearing health care should be reviewed, as well as an outline for when your next assessment should take place with the focus around better hearing health. Recommendations for hearing loss could include a combination of the following. It could be a hearing aid, prescription or non-prescription. It could be a discussion regarding an implant, such as a cochlear implant or bone conduction devices, assistive listening devices, communication strategies, or just general hearing health education and counseling. These are the recommendations that should follow a thorough hearing aid evaluation. So what is a prescription hearing aid? Hearing aids are medical devices, and within that medical device is a prescription that should be based upon your hearing test results as well as other measurements within your ear canal. Hearing aids are prescribed and programmed by a hearing care professional. They fit to a unique prescription that is based upon the degree of your loss and verified in your ear canal with real ear measurements, taking into account its unique characteristics. I joke with my patients all the time and say, I've never met an average ear canal. And the software for which hearing aids are programmed are based on an average ear canal. So measurements within the canal are unique to you and customize that fitting, ensuring that the prescription is accurate for you. Custom fit and ongoing support and education and counseling from these qualified hearing healthcare professionals are key. It means that it's customized to fit your needs and your lifestyle. And that's what a prescription hearing aid does. It ensures that that customization has taken place. Over-the-counter devices, which is a new term that has come up, or online purchases more recently. Direct-to-consumer hearing aids in various forms have been around for a long time, but the over-the-counter as a category has really only been around since October 2022. And these over-the-counter devices are hearing devices that are purchased in a store in the USA or online without the guidance of a health professional. And that's the important part. They are without the guidance of a health professional. There is no diagnostic evaluation necessary to purchase them. They're usually based upon someone who is perceiving that they have a hearing loss. These types of devices are only recommended for those with perceived mild to moderate hearing losses. If you have perceived losses that are greater than that, you should always see a hearing healthcare professional. It's a one-size-fits-all. They're not programmed to a particular prescription. They are not customized to you and your needs, nor are they verified using those measurements of real air that we talked about. Sound is dependent solely on the wearer's perception. So most times the wearer's perception is an inaccurate representation of their loss, which results in an under amplification. They are usually a lower cost, but that is because they are without the ongoing care of a healthcare professional. And what is an implant? Now, we could spend a whole discussion on what is an implant, and I won't get into all the research and all the wonderful things that implants can offer. I will say briefly that they are mostly suitable for people who cannot benefit from a appropriately programmed hearing aid. You have to be a medical and audiological candidate. They are typically fit through Eastern Health for a cochlear implant in the province of Newfoundland and Labrador in consultation with a team of audiologists and an ENT. versus bone conduction devices that are offered within the province can be funding options through the provincial hearing aid program or through New Life Hearing, who are trained in implants. Assistive listening devices are a wonderful supplement to those, and using good communication strategies is a wonderful supplement to those using amplification, because sometimes hearing aids are just not enough. We need to focus on, how are we supplementing our hearing health? This is part of the needs assessment that we talked about for assistive listening devices and communication strategies. If you have poor speech understanding or discrimination, you may need a little bit of extra help to help in those challenging listening environments to help filter all the speech through the noise. So your cell phone with connectivity through hearing aids today can have an app that can help you utilize some changes to your hearing aids in real time. There's remote mics, TV streaming devices, and FM systems. Again, this is a more in-depth conversation and should be happening with your healthcare professional to review through your needs assessment everything that's going to give you that better output for understanding and communication. So what will work for me? So once the type and degree of your hearing loss has been determined by an audiologist, you can make a better decision regarding treatment. Whatever device is chosen, a diagnostic exam by an audiologist is always recommended as the initial first step. The audiologist will check for common medical causes of hearing loss that should be ruled out prior to treatment. So how do prescription hearing aids work? So hearing aids are primarily useful in improving hearing loss and speech comprehension for people who have hearing loss, but they absolutely do not restore hearing to normal. We are not regrowing nerve cells or sensory cells in the inner ear. The surviving hair cells or sensory cells pick up sound vibrations that are enhanced by the hearing aids and transmit it to the auditory nerve, then up to the central auditory processing centers in the brain. Hearing aid success is limited by the surviving hair cells as well as our ability to understand speech or our speech discrimination. Consistent use with amplification is key. You should expect some success in moderate noise environments. However, that depends on a lot of variables, such as the speaker, the acoustics of the room, the type of hearing aid you have, your attention level, speech understanding, and overall noise of the room. The use of assistive listening devices and good communication strategies are usually necessary to supplement the use of a hearing aid. So what are some best practices for choosing a clinic? Have a complete hearing assessment with a needs assessment completed, as we discussed. Hearing aid selection, it's not a one-size-fits-all. You have various types of hearing aids, so receiver in the canal, custom fitting hearing aids, rechargeability, 1 versus 2. Most times if there's hearing loss in both ears, we need hearing aids in both ears. We're born with 2 ears for a reason. It's not to make us look symmetrical. It's actually to help us hear better in noisy situations. The level of technology should be discussed. Hearing aids come in entry-level, mid-range, and advanced technology, each with various features that help us communicate in different types of listening environment. So this is helpful because it is part of that needs assessment. It really does help us review that. All hearing aids, prescription, or should be fitted and verified. The ear canal needs to be examined. Wax should be removed if necessary. Real ear measurements should be completed. And this is a form of verification that allows the prescription to be fitted more appropriately or more suitable for you and your hearing loss, as well as the shape and size of your ear canal. Only then can it be programmed correctly. So best practices, again, continued for choosing a clinic. So then once we have a thorough hearing aid examination in combination with that needs assessment, in combination with choosing the proper hearing aid or assistive listening device for you, then we need to be orientated towards the physical feel of the hearing aids. Are they comfortable? Can you put them in? What is the everyday use, such as rechargeability versus a battery? What is the cleaning and maintenance required that should be reviewed with me, as well as the connectivity and the use of apps that are available through various manufacturers offering prescription amplification. And then, of course, follow-up. Ongoing, regularly scheduled items should be reviewed, repeated, questions answered. There should be ongoing clean and checks, professional clean and checks of your devices to make sure that they're always optimized for your best hearing and communication. You should get repeat hearing assessments. Hearing can change as we age. Ensuring that the prescription is accurate for you on an ongoing basis is important to your success. So the goals should be verified and outcome measures also verified or validated. What that means is that typically questionnaires could be completed to make sure that your goals and priorities are being met with regards to your amplification. Sometimes audiology clinics will do testing within the booth to test the functional ability of speech and noise to make sure that the outcomes are expected when you're wearing your hearing aids. So the rehabilitative journey to better hearing is a complex one. It's not as simple as passing a hearing aid across the table and say, there you go, let us know if you need us. That just doesn't work. That's when hearing aids end up in dresser drawers, and that's not helping your hearing health. Realistic expectations do need to be set. We're not regrowing hair cells in the inner ear. We're not restoring hearing to normal. Adjusting to new amplification takes time. Again, remember we spoke about how you've acclimatized to that loss. It becomes normal to you. So time and patience is key. And wearing your hearing aids consistently is key. We need to retrain the brain how to take in all the sounds around us, and that takes time. And also the importance of having that verification through your hearing healthcare provider, the validation that you're getting the outcomes that you feel and your hearing healthcare professional has discussed with you. And of course, the follow-up, having that counseling, having your hearing retested, having those professional clean and checks are all a part of the rehabilitative journey to help you hear better. So some important takeaways today. The guidance of an educated and expertise of an audiologist or hearing healthcare professional is an invaluable thing. If you're choosing to be your own expert, please be educated and do your research. Make sure you're comparing apples to apples and not apples to oranges. Always have a diagnostic evaluation completed prior to the purchase and know the limitations of an online purchase. Online hearing assessments are not the same as a diagnostic evaluation. And the use of best practices is of utmost importance in your new hearing journey. Choose a hearing care professional that is focused on follow-up, services, and those use of best practices. It's a jog, it's not a sprint. Treating your hearing loss and improving communication while reducing the effects of an untreated hearing loss should be your goal. Choose a clinic that focuses on your hearing healthcare needs. I hope you have enjoyed my presentation today. It's a lot to take in a very small period of time. I'm opening it now up to some questions, and hopefully you've enjoyed learning all about how to treat your hearing health.
Thank you very much, Jillian. That was a very informative presentation, and I'm sure very helpful to people in the audience today. The first question we have for you, Jillian, is about using earplugs. Does it affect the hearing?
No. I'm not really sure in the context of what that question is being asked. Wearing hearing protection in, intense noise, such as workplace noise exposure, is important for protecting your ears. Wearing hearing protection on an ongoing basis is not going to cause hearing loss. However, it will impair your ability to communicate effectively, depending upon how the degree of that hearing protection is. Sometimes I have patients who, for example, have conditions such as hyperacusis or have suffered concussions, who feel more comfortable wearing hearing protection because it helps reduce their sensitivity to sound for a condition that they experience. But it doesn't cause any hearing loss. No.
Great.
I hope I answered that question correctly.
Thank you very much. The next question is, are baseline hearing aid tests covered under MCP?
The Department of Audiology through Eastern Health will see adults for hearing assessment. It's unfortunate because I do think right now there is an extensive wait list, but it is possible to have your hearing tested through the audiology department at Eastern Health that is covered by MCP. Your family doctor does not need to refer you. You can certainly reach out to the audiology department of Eastern Health and recommend or suggest or provide your information to go on the list to have your hearing tested through a private practice clinic that are in the surrounding areas of Newfoundland and Labrador. You can certainly just call and inquire about their costs for a complete diagnostic assessment.
Wonderful.
I should make a note to say, just be careful when you're calling, because free is free and nothing is free in this world. So make sure it's a screening versus a full audiological assessment that you are receiving, if it is in fact marketed or disclosed as a free assessment. Make sure again you're comparing apples to apples, because no one works for free. So there are costs incurred with the services of a hearing healthcare professional, and that should be expected.
Wonderful. Thank you, Jillian. The next question asks, what advice would you give to someone whose family member shows signs of hearing loss, but refuses to get their hearing checked?
That's wow. I hear that every day. And I sympathize because it is tough. And, I think maybe letting them listen to this presentation might be a good step. Understanding and presenting to them what your frustrations are and discussing with them the risks of an untreated hearing loss. Some people get discouraged about coming in to see a hearing healthcare professional because they're a bit nervous about what the outcomes mean from the hearing test results. But sitting down and chatting with a hearing healthcare professional and reviewing your hearing loss is just information gathering. It doesn't mean that they need to seek treatment immediately. They can go home, they can think about all the test results, they can think about everything that was discussed. It's a process. Remember that statement that I said, it's a jog, not a sprint. So, if the individual is struggling to come to terms, I think it's important to present them with information regarding the risks of an untreated hearing loss, as well as the frustrations from the partner or significant other in what their worry is with regards to their inability to communicate effectively.
Wonderful. We've got lots of questions here, which is wonderful. Is listening to music, podcasts, etc., using earbuds or AirPods, headphones, dangerous to hearing health?
Yes, it can be. A lot of the new listening devices, AirPods and the like, now have safety features built into the smartphones and the headsets, so that you can actually set limits on how loud you're turning it up, so that it will give an indication to you if the loudness of the music coming in through is damaging to your ears. There's been copious amounts of research done on the effects of earpods and listening to headphones in our teenagers, actually. And it's at the forefront of a lot of research where we're seeing increases in hearing loss in our teenage population. So the big thing is with the inserts, so the ear pods, is that they reduce the distance from the sound coming from the end of the ear pod to the eardrum, which reduces the physical space. So that gives an increase in the volume of the sound. So on paper, if we were to measure where that sound of loudness is, it's actually louder than what it is on the dial on a volume control, because that ear canal is giving that natural boost because of the reduction in the volume or physical space between the end of the ear pod and the drum. So this is where we often get into some damaging effects. So I often will suggest to my own children, as well as any patients coming in through the clinic, to set those limits on your smartphone and headphones so that you can be at risks or at less risk. And, the big thing with noise exposure, it's reducing the intensity of the sound, but also the duration of the time exposed. So take breaks. Don't have your headphones on for 8 hours a day. Listen for a couple of hours and then take them off for a couple of hours.
Excellent. We have a lot of great questions. Love it. Hi, I have a question about the impact of hearing loss on falling. Does hearing loss itself cause imbalance and increase risk of falls?
Great question. The hearing organ, or the inner ear, is kind of a neighbor to our balance system, or the semicircular canals that keep us upright. A lot of the research on falls and untreated hearing loss is tied to the somatosensory system. So that's how our muscles and our eyes and our ears all work together to keep us upright. That somatosensory system or analysis kind of changes, and that makes us more at risk. So we have less of an awareness of our surroundings because of our hearing loss. We have an inability sometimes to localize where sound is coming from, to hear things around us the same way. And those impacts to the inner ear, as well as the somatosensory system and sound awareness around us, puts us more at risk.
Excellent. Thanks, Jillian. How much does a private hearing test usually cost?
That's a big range. It can range, I've heard, anywhere from free, which again, nothing is free. So just be careful in that word of free. Make sure you're getting that full diagnostic assessment with the review and the counseling. Again, it should be about 45 minutes to an hour of your time. And then it can range upwards of, I've heard $50 to, $120 to $95. There's a full range depending upon what the clinic offers as part of their diagnostic assessment, because some clinics are doing a little bit more extensive testing maybe than others. They're spending maybe more time with counseling and a needs assessment than others. It's important to check with your private insurance, as most private insurance nowadays are covering hearing assessment.
Wonderful. And possibly the last question that's here right now. How can you see your ENT within 48 hours? I called mine for an appointment in February and I have an appointment in June.
That 48-hour recommendation is only in the scenario of a sudden sensorineural hearing loss. So that's an individual who wakes up one morning, all of a sudden their hearing is gone. They're experiencing, it's usually on one side or unilateral. They're experiencing tinnitus, vertigo or imbalance, nausea, vomiting. That is a medical emergency, and that is when you would need to see either an audiologist, get your hearing assessed, who can shoot you off to see an ENT within that 48-hour time frame. Sometimes there is a lag in that because of scheduling, or it happens on a weekend, or whatever may happen. Usually with a sudden sensorineural hearing loss, intervention that can happen within 10 days of onset of symptoms is usually advisable, but the best outcomes for rebounding or recovery are typically seen within the first 24 to 48 hours suffering a sudden loss. A lot of my patients express frustration with regards to referral to many various types of specialists within the province of Newfoundland and Labrador these days. Healthcare is been a little bit up and down over the course since the pandemic. And I would express, if it's something urgent that you need to see an ENT, certainly go back to your family doctor to express that urgency so that your family doctor can maybe take steps to expedite that referral to an ears, nose, and throat professional.
Excellent. So that looks like our last question today. So I just want to thank everyone for attending today, but most importantly for Jillian for this very informative presentation, and as well as her long-time support of the Canadian Hard of Hearing Association. The information you covered will certainly comes from, from knowing the roles of the different professionals, all the way to taking the mystery out of the process of having your hearing loss identified and the treatment options that are available, all towards a journey for better hearing. So thank you so much. And thank you everyone in the audience. Thank you so much again, everyone, for attending, and Jillian for your wonderful presentation. Take care, everyone. Bye.